Good morning, everybody. This is Dr. Sonia McGowan with Covenant Pediatric Wellness Center, and I'm so happy you're here with me for our monthly webinar. Just a little housekeeping. If you have questions as we walk through the material, just put it over on the sidebar. There's a Q&A box that you can add your questions, and I will answer them as I'm able to. We'll also save some time at the end for some questions as well. So probably most of you know me, but in case you don't, again, I'm Dr. Sonia McGowan. I'm a pediatric chiropractor. I am also a MAPS physician. MAPS stands for Medical Academy of Pediatrics and Special Needs, and an elite group of doctors for sure who specialize in kids with autism, PANS, and other complex needs. I am married to my sweet husband, Shannon. He is a newly retired CPA. We have Libby and we have Rowan, both who are grown and flown at this point. So Libby is a music director for the School of Rock program in Overland Park, Kansas. Rowan is a junior in college at Millikan University. He is a theater costume design major. And then we also have Ozzy, who is our sheepadoodle. He's soon to be 2. He's a lot bigger now. This was when he graduated from puppy school. So anyway, pretty happy family we have, and blessed to have that. So Covenant is a one-stop shop for families. So part of the reason that I have designed the practice the way that I did is because our son Rowan had a lot of challenges when he was a little guy. He had eczema, he had diarrhea, he had self-injury and aggression, and he was nonverbal. And so it was really, really hard to find help for him. And so I made up my mind that if I was ever in a position to help other moms who had complex kids, I was definitely going to do that. So at our practice, we really focus on complex kids through functional nutrition, pediatric chiropractic. We also have hyperbaric oxygen. We have ion cleanse. We also have what we call the Spot for Tots, where we do comprehensive evaluation and intervention for kids who have tongue, lip, and cheek ties. We also do a lot of work with pregnant moms and new babies via prenatal and pediatric chiropractic. And then we work with regular adults too. So for chiropractic, ion cleanse, detoxification, we do nutrition testing, food allergy and sensitivity testing. We do basic labs as well as acupuncture. All right. So when I say complex kids, what do I mean? Some of them are obvious, right? So kids with autism, kids with PANS and PANDAS, kids who have ADD or ADHD. Also, just kids who have behavior, language, and socialization challenges, kids with sensory processing issues, kids who have oral restrictions, so tongue and lip ties, kids who have retained primitive reflexes that are getting in their way, but then also what I call square peg round hole kids. So these are kids who may not have a diagnosis, but they're struggling. So maybe they don't sleep well. Maybe they are super selective eaters. Maybe they aren't good poopers, right? So they're just, in general, things are not coming along quite like parents would like them to. And so we're just really good at digging in and trying to find the root cause for their behavior, socialization challenges, their language issues, sensory processing issues, etc. So we have a couple of mottos here. We always say there are no bad kids and that there are no purposeless behaviors. And so we're always looking for the why behind behavior. And this is what we're going to talk a lot about today, is really digging in and looking for root causes of kids' issues. So how do we know if a kid is a complex kid, right? So we have to take a thorough history. We believe parents know their kids best. And so we listen when parents tell us things, right? We also look at physical signs. We look at behavioral signs as well. And I'm going to walk you through some of those. So on history and exam, I ask about and I listen for a lot of things. So during their infancy, we know about their milestones. Were they early with anything? Were they late with anything? I used to think that before I was a chiropractor working with complex kids, I used to think that when kids hit their milestones early, that was kind of a badge of honor, right? So I remember when Rowan was born, he was a giant baby. He was almost 10 pounds. And I remember the nurses saying, "Oh my," that they called him Tank because he was really big and his chest was bigger than his head. And so he's just a few hours old and he's like trying to get out of the blanket. He's like lifting his head up. And I remember writing in his baby book that at 3 days old, he rolled over. And I was like, and I even wrote, no one will believe me when I say he just rolled over at 3 days old. And so I thought, wow, he's so advanced. And then when he walked at 9 months and he ran at 9 months and 1 day, I thought, wow, he's so advanced, right? But what I didn't know then is that early milestones are a red flag for sure. And so I want to know about other things like, were they able to nurse? Did they do it successfully, effectively? How was their sleep? Did they have colic as an infant? Did they have torticollis or plagiocephaly? So torticollis is when a baby or a child's head is stuck like this. So rotation and lateral flexion. And often that sort of postural distortion will cause a change in head shape. So plagiocephaly is a flat spot on one side of the head. And so babies with oral restrictions tend to have torticollis. They tend to have plagiocephaly. So, I'm looking for all those kinds of things. I'm also always asking about early antibiotic exposure because that is definitely a theme I've seen over my many years doing this, is that babies who get early antibiotics in a large amount for ear infections, for, whatever, tend to struggle later. This photo is actually my daughter, Libby. She had lots of these issues when she was tiny. What I didn't know then, and what we discovered when she was about 17, is that she had a severe lip and tongue tie. And so we finally discovered it at when she was a teenager. We had her tongue released. We did not release her lip. And the changes in her were phenomenal, but it explains why she struggled with nursing. And yeah, just several things. So, all right. As a toddler, then I want to know about their temperament. Were they happy? Were they angry? Were they irritable? What about their energy level? So a lot of times what parents will tell us is that either kids never ever slow down, that they just go like wildfire all the time. Sometimes parents will say they'll go like crazy and then they crash. Some parents say that they just are a little bit lethargic all the time, that they physical activity is hard for them. It takes a long time for them to recover from that. This can be a definite sign of not making energy inside the cell. And we're going to talk more about that. And Yolene is here. She says, "Good morning, Dr. McGowan. I am so happy you're here." Oh my gosh. All right. I also ask about milestones. I ask about things like ear infections and tubes, how they responded if they got vaccinated, and if they had any regression. So it's pretty common for us to see kids who, meet certain milestones and then either their development stops or it regresses. And that's a really important thing for me to know. And then I always ask parents, when did you notice that something seemed different with your child? When did you start getting kind of that feeling like something isn't quite right? And we always talk through that. And then in general, I want to know, does their behavior improve when they are sick, when they have a fever? Have they ever had any urinary changes? So a lot of times we'll see kids who are completely potty trained. They're dry at night, dry in the day, and suddenly they're wetting the bed or they're wetting their pants. They're urinating in public with no apparent notice. We also see changes like more urinary frequency, urgency, volume, things like that. And I'm also always asking about anything that has what we call an overnight onset. So an acute, sudden onset of a change in that child is very important. And so my big three that I always ask: how do they sleep? How and what do they eat? What's their appetite like? How selective are they? And how are they poop? coping? Are they constipated? Do they have diarrhea? Maybe they have a little of both, right? A lot of kids will have what we call breakthrough diarrhea, where they're constipated, but then they have diarrhea that comes out around that. And so I'm also looking at physical things when I do an exam. So I always look at their skin very carefully because the skin is a reflection of the intestine, right? And so if I'm finding eczema or, hives or rashes or psoriasis, anything like that, I'm going to be concerned about that. And it's super common for complex kids to have eczema on their faces and on their flexors. And by that, I mean the bends of their elbows and the backs of their knees. Both of those are really strong indicators of a gluten sensitivity or allergy. And in general, we really don't wait when it comes to eczema. We know that eczema is sort of a predictor of other things that are not good. And so we definitely don't ever want to wait and see on that. As far as their skin, I'm also looking for what we call KP or keratosis pilaris. Some people call it chicken skin. It's those little bumps, those rough bumps that are often on the upper arms, but sometimes we'll see them on the legs, on the abdomen, on the back, on the cheeks, etc. I'm looking just in general for dry skin, dry lips. I'm looking at in asking about odd body odor, stinky feet. I'm looking to see if they're pale and may have some dark circles under the eyes. I'm looking for all this because it gives me clues about what could be happening with their metabolism. So might they have food allergies or sensitivities? Might they have nutrient deficiencies, mitochondrial dysfunction, intestinal dysbiosis, right? So I'm looking at all these things, trying to determine, okay, what could be the root cause of these challenges and how can we use functional nutrition to fix that? So this is a classic herpetiform rash. So generally we see this on the backs of the knees, sometimes on the elbows as well. This is a dead giveaway for a gluten issue. I'm also looking at hair. So if their hair is flyaway, if it's thin and sparse, if it's not growing like it should, those are all red flags. And often when we see hair that isn't growing as fast as it should, we also see that with the fingernails and toenails as well. Lips give us lots of clues. So we see a lot of dry lips. Super dry lips like this can mean dehydration, but sort of even deeper, it often is a fatty acid deficiency. So an omega-3 generally. Most of our kids are really, really low in anything related to fat. So omega-3s, vitamin D, cholesterol, all of those things tend to be low in our kids. Sometimes we see what's called cheilitis. So it's basically sores at the corners of the mouth. This is very suggestive of a certain mineral deficiency. I always look at the tongue if the child will let me. So these are a couple of examples of what I often see. I often see what's called a geographic tongue, meaning that the tongue kind of looks like a map. And so this is very indicative of intestinal dysbiosis and very frequently of yeast causing that dysbiosis. We also see lots of patterns like this, where there's a big fissure down the middle of the tongue. Maybe there are fissures sort of at the periphery. The other thing I'm often looking for is if the edges of the tongue are scalloped. So all of those things tell me about, nutrient absorption, nutrient deficiencies. The scalloping on the tongue often tells me that maybe they're not breathing appropriately at night. Maybe they have some oral restrictions. All right. I always look at fingernails. Fingernails tell us a lot. So for example, the white spots on the fingernails are generally a sign of a mineral deficiency, most often zinc, not always, but it's definitely leading me to look more deeply at deficiencies. Sometimes we'll see spooned nails like this. Sometimes we'll see ridged nails, but all of these signs give me clues of what sorts of testing would be appropriate for this child. I'm looking at their head as well. So I'm looking for a prominent forehead. I'm looking for a head that seems out of proportion. And I'm also looking for those head shape differences, the torticollis, like I talked to you about before. a prominent forehead that doesn't really seem to be something that runs in the family is often a vitamin D deficiency. And most of our kids, I would say 95% of the kids we test are low in vitamin D. I also look at their belly. I listen to it, I palpate it, and I ask about digestive symptoms. So it's really common to see a bloated abdomen. Often, what we'll see along with that bloating is kind of an old man bottom, right? So their buttocks are a little bit wasted. And then we also see or hear abnormal bowel sounds as well. And then behaviorally, so these are clues that tell me something isn't right in their chemistry. So, do they have deficiencies? Do they have gut problems, right? And so often we will see kids who are very selective eaters. I have lots of families who come in and they're sort of ashamed because they'll say, please don't judge me. My kid only eats 3 things, right? And so selective eating can have lots of reasons, right? So sometimes they're selective eaters because they have a tongue tie, right? And they choose foods that are easy to manage with limited strength, stamina, mobility of their tongue, lips, and cheeks. Sometimes kids are selective eaters because they have a lot of nutrient deficiencies. So when you have a lot of deficiencies, it can make food not taste right to you. And so food doesn't taste right, so you eat less. So you have deficiencies, which make you eat less, and round we go. A lot of times kids will do what we call grazing. So they won't sit down and eat a full meal. They'll just snack sort of constantly throughout the day. And that is really kind of a strong sign of belly problems. So a lot of times kids will have belly pain, but they don't have the vocabulary or the language skills to be able to say, hey, my belly hurts. So whenever I see grazing versus just sitting down and eating a whole meal, I'm very suspicious of belly pain. So again, selective eaters, but also a self-induced limited diet, and then cravings for certain things often give me clues as to, do they have certain deficiencies? Are they able to make energy from their food? Sometimes gut issues too will cause kids to crave things like sugar and carbs. This is something we call posturing. So when I see a kid who is doing whatever they need to do to put pressure on their belly, it's telling me that they have belly pain. So these are 2 kids, don't know each other, live far, far away from each other, but look, they're in the very same posture. And so this is just an absolute red flag for constipation, abdominal pain, things like that. So again, digestive challenges are huge for our kids. So we see the posturing like I just showed you. Often very gassy, very bloated. They often have reflux. A lot of times kids will drool. And so if they're past the age, where they should not be drooling anymore, and they are, that is a very strong sign that they might have some acid reflux. Pretty common for us to see undigested food in the stool as well. This is a major red flag that they need digestive enzymes. Belly aches, certain food will cause behavior increases and or physical changes. So I remember one time a family brought a child in and they needed a snack, and the family happened to have some Cheetos. Gave the child just a couple of Cheetos and immediately their cheeks turned red. And so I'm thinking, okay, so is it a corn issue? Is it an artificial color issue? Is it something else? Right. But when you see food causing a physical change like that, it's definitely something to pay attention to. We often see kids who grind their teeth. So that's also called bruxism. So when kids grind their teeth, it can be a sign for parasites. It can be a sign of sleep disordered breathing, maybe oral restrictions as well. So we definitely pay attention. Sometimes when kids grind their teeth, what they're trying to do is pull their lower jaw forward so it opens up their airway. So there can be a couple of reasons for that, but we definitely take that seriously. Lots of poop problems. So these are kids who are constipated, kids who have diarrhea. Sometimes, like I mentioned, they have both. But it's super common, regardless of their poop habits, to see kind of strange poop. It's a weird color. It's a weird consistency. It's a weird shape. And often we have, as I mentioned, the undigested food, but we'll also have really odd smells to their poop as well. Sometimes kids will smear their feces. And then sometimes kids will withhold their poops. So they need to go, they feel the need to go, but they won't let themselves. And that's what's happening with this little girl in the picture. It's kind of a dark photo. It's not the best, but if you look at her legs, she's got her legs crossed. This is her attempt to withhold her poop. And it has caused her knee joint to change shape, because this is a posture that she keeps pretty consistently. Sleep challenges are big for our complex kids. So a lot of times we'll see kids who get hyper at bedtime. The other thing that often happens at bedtime is a spike of anxiety. This is common, but it is not normal. Okay. So if your child is like this, you definitely need to get a consultation with someone like me. Laughing in the middle of the night, early waking can both be signs of intestinal yeast. Restlessness, sleeping with mouth open, snoring, or breathing audibly are all signs of oral restrictions. All right. Energy issues. All right. So if you haven't heard me talk about mitochondrial dysfunction, I would really like you to dive into that. If you go to my website, thewhymatters.net, and you go to the webinar tab at the top, you will find a couple of webinars about mitochondrial dysfunction. So basically, this is exceedingly common in complex kids. They do not make energy inside the cell very effectively. And when this happens, it's sort of like they have no gas in their car, okay? And this will cause things like low stamina. It will cause them to need a lot of time to recover after physical tasks. They often want to be carried. They want to ride in the stroller. If they have language, they'll tell you, my legs hurt, I'm really tired. And this picture is one of my favorite kids in the world. He is working with our OT, Liz, and they're doing some feeding therapy. And he has very significant mitochondrial dysfunction. And so this is him having some food, but he could only eat lying down, because it was just the expenditure of cellular energy to eat was so extreme for him that they couldn't also sit up at the same time. So mitochondrial function is one of the core things that we look at first and foremost, because if this is an issue for a child and we don't know it or we don't fix it, nothing else is going to get better the way that it should. So complex kids are the kids who are often forgotten by regular medicine. So families will tell their general practitioner, their pediatrician, hey, I'm concerned, can we check for anemia? Can we check for, vitamin D status? And they're often told, oh, it's just autism. Oh, it's just pandas, right? So I just met with a family who had a kid who didn't poop for 11 days, right? And parents are often told, oh, it's just autism. Don't worry about it. We'll wait and see. We'll see how it goes, right? And because of their diagnoses, whatever the diagnosis is, often they're ignored or denied just basic lab tests and medical care because of their diagnosis. So I've got a couple kids to talk to you about. So this is Nora. At the time that we worked with her, she was 5, typically developing probably a gifted IQ, but she had an acute onset of some symptoms, right? So separation anxiety, certain fears. She couldn't look at or talk to certain people in her family. She couldn't sleep alone. And she would have episodes where she just couldn't calm down. She would get herself so upset. She had a lot of headaches, motion sickness, really low stamina. And so when I examined her, I noticed several things, right? She had some issues with her deep tendon reflexes. She had a geographic tongue. She had low tone. And so we did some labs with her because I knew that there had to be a reason for this perfectly neurotypical child to suddenly have an onset of these sorts of symptoms. So we did a urine test with her called the metabolomics. This is a test I do very, very frequently with complex kids because it tells me almost everything I need to know about, does functional nutrition apply for this child? So here's an example, one of the pages of the test. It tells us about nutrient deficiencies. And so what you see over here are the nutrients. Green is good, yellow and red is not good, and then the black diamond is where the patient stands. And so you can see, despite having a normal home life, right? These are normal people, they eat real food, they cook from scratch. She had developed some pretty significant nutrient deficiencies. So she's deficient in all of her antioxidants, in all of her B vitamins, in magnesium and manganese. She also definitely needed a digestive enzyme and a probiotic. There's also, so again, this is urine. There's also a finger stick component to this test that gives us her the omega 3, 6, 7, and 9 fatty acids, but Nora couldn't do that. It was too scary for her. So we don't have her omega 3 levels. This might be a little hard for you to see, but what we're seeing here is another page of the same test. This is telling us about her intestinal health, this top left quadrant. And this first section tells us about intestinal malabsorption. So you can see it's pretty severe for her. She's got some bacterial and major yeast dysbiosis markers. So she's got a lot of gut problems, right, that we had to deal with. When we come down here, this is telling us about, can she make energy inside the cell? So she's not good at turning fats or carbs into energy. And then her Krebs cycle, so that biochemical cycle inside the mitochondria that helps you make ATP or cellular energy, for her, it was very dysregulated. So sometimes that can happen because you have nutrient deficiencies, which we know she had. Sometimes it can be caused from infections or pathogens or toxins as well. So we work to kind of figure all that out. We also saw that her serotonin right here was not where we wanted it to be. That's often because of intestinal dysbiosis, okay? And then she also really struggled with her detox pathways. So what we found, again, mito dysfunction, we found deficiencies, intestinal health problems, and a page I didn't show you also reflected that she had too much ammonia in her system. And so when we addressed all of these things, plus we adjusted her, we did craniosacral therapy, we did retained primitive reflexes activities, she, within just a few months, she was back to normal, really acting like herself. All the fears were gone. She was interacting with family appropriately again. So if the family had gone another way, right? If they had gone to maybe a counselor, a psychologist, right? Those folks are fantastic at what they do, but this was not an emotional psychiatric issue, right? It was a biochemistry issue that we identified and we corrected. Okay, come on, there we go. All right, here's another kiddo. This is Corwin. He started seeing me at age 5. He's 7 there. He's a couple years older than that now, but he came to me with severe mouth ulcers. He had diarrhea, frequent urination, very frequent and very high fevers that would last a week or a week and a half at a time, as well as severe anxiety. And so he had missed the majority of his kindergarten year because he was sick all the time. And so what you can see here is the geographic tongue, the white coated tongue, lots of ulcers back there in his mouth. You can see it was very difficult for him to eat or drink or swallow anything. You can also see he has kind of some dark circles under his eyes as well. And so when we did, it's the same test, it's just a different format. They updated the format since I did this with him. So his adult teeth weren't coming in like we would have expected. Again, with the geographic tongue, the very severe mouth ulcers, his eardrums were bulging, dark circles under his eyes, lots of skin issues as well. And so you can see he had some pretty significant nutrient deficiencies. We also did a stool test with him, and we found some really ugly bacteria overgrowing in his intestine. We found that his secretory IgA, which is a certain class of antibodies in the intestine, were just absolutely on fire. And then we did some food allergy testing too, food allergy and sensitivity. And so we found lots of hits there as well. And so I was very concerned about strep for him, but it came up negative. Basically, we changed his diet. We worked on his intestinal health. We gave him some mitochondrial support. We adjusted him. We did craniosacral therapy, and he's never looked back. Like, he's totally fine, going to school every day, typical boy. And so what we do here is, again, we're looking for the root cause. We're looking for the why behind kids' issues. If, it's common, but it is not normal for a 7-year-old child to have extreme anxiety, right? Or to have phobias. It is not normal for that, right? And so if you're concerned about your child, we have lots of ways to help you. We do a great deal of nutrition testing, and we have various options for that. So we also look at intestinal health with lots of different options for that as well. We also are very, very good at drawing blood on kids, and we make it as not a scary experience as possible for them. It's really super important that we do some basic blood work with kids, because the patterns that I see after, literally thousands of kids have come through this practice. Like I mentioned before, we see things like anemia, very common, low iron. We also see really low cholesterol. Low cholesterol is a huge deal. And if you go to that same website that I mentioned, thewhymatters.net, you can find blog posts. You can also find webinars that talk about why cholesterol is so important for complex kids. So we see very low cholesterol. We see low vitamin D. We see low omega-3s. And so it's just really important that we dig in and do the appropriate tests for kids so that we can have the whole picture. We can figure out exactly what they need so that we can correct their chemistry, and then their body will heal. Generally, we don't have things like deficiencies to pharmaceutical drugs, right? We have to figure out what the problem is and fix that rather than putting a Band-Aid on it. So we are very, very good at analyzing test results. What makes me absolutely crazy is when other practitioners do tests on kids, whether it's a urine test, stool test, blood test, and they have no idea how to make sense of those results and how to turn it into a care plan for a family. If you're not qualified to do it, don't do it, right? But we are very good at analyzing results and turning it into a plan that is manageable for the family. And the results we get really they speak for themselves. We see astounding results every single day with both complex kids and what we call complex adults. And so to always keep the fact that the why matters at the forefront of your mind. Look for the real reason. Don't rely on a Band-Aid. So this is the contact information for our clinic. We are always taking new patients. I am actively training up a second doctor to do the same sort of functional nutrition that I do. And so we're able to take on even more patients because Dr. Lacey Mays is helping me. She's learning the ropes. All right. So Yolene says, my 14-year-old was a 28-week preemie, met all milestones, very intelligent until 5th grade when she regressed a lot. Middle school was challenging. Now in high school, starting 9th grade. Okay. How on earth is she already in 9th grade? It feels like she should still be a little tiny thing. I think there are some underlying issues going on, but when I asked her pediatrician, he just wanted to check her for ADHD, which he said she doesn't have. Now she's very stressed and overweight. Yeah, we may want to have you look at, whether it's me or someone else, finding a functional nutrition provider who can do the sorts of tests that I do some lab work, some blood work with her, do maybe a stool test, maybe the metabolomics, organic acids test. I think that would be really smart to just kind of get a fresh look at what could be happening with her. Yeah, it really sounds like that would be the right thing to do for her. So I'm sorry she's struggling. I know it's been a long road for you guys. Okay, any other questions while we are together? Just a reminder, and I'm going to put it in the comments. The website that I mentioned is called thewhymatters.net, and that's where you're going to find all the blog posts that I've ever written. I do 2 of them per month. It also houses everything, every webinar that I've ever done as well. So you can go back and watch the replay very easily. All of the webinars are also on YouTube. We have a YouTube channel that houses all of that as well. So Laura asks, does low cholesterol last a lifetime? That's a great question. So for some people, they need cholesterol support throughout their lives. My goal, though, is to get cholesterol where it needs to be, fix any underlying contributor like intestinal dysbiosis or malabsorption, nutrient deficiencies, things like that, so that the body goes, oh, I'm supposed to be making more cholesterol, right? And can do it on its own. That is generally what I see, but I do see, several patients who kind of need ongoing monitoring and intervention for low cholesterol. Yeah. My next question is for Gabby. Okay, so you were talking about Gabby's sister above. Now this is Gabby. Okay. She has ASD. I had to put her on medication. She's been aggressive. Her A1C is 6.2. The endocrinologist wants to put her on metformin, and I told him no. Gosh, I'm kind of with you there. I mean, I feel like digging a little deeper to figure out the basis of her blood glucose dysregulation first makes more sense than jumping right to metformin. I mean, I agree that glucose needs to be stable. The more stable glucose is, the healthier your body is, the better your brain works, the better your behavior can be. But I feel like to jump right to metformin seems like a lot. I think, doing some additional testing to see if we can't figure some things out first. And, if we can't figure it out, if we can't fix it, then maybe considering metformin might make sense at that point. Yeah. Okay. Any other questions before I let you get on with your Friday and your weekend? Okay, very good. So if you ever have questions, you can email me, Dr. Sonia at, here it says, that's a perfectly fine email, Dr. Sonia at drsoniamcgowan.com. I also actually prefer Dr. Sonia at covenantwellness.net. Our website has lots of information. The whymatters.net has lots of information and resources for you as well. But I'm happy to answer questions anytime. So thank you so much for joining us. I always appreciate it. Anyone who registered for this automatically can get access to the replay, but within a couple hours, we always put the replay up on the website as well. So, all right, guys, thanks so much. It was good to see you. I hope you have a great weekend. And next month, we will be talking about pandas. And the webinar would be Friday, October 3rd at 9 a.m. So we'll be talking about pans and pandas next month, October 3rd at 9 a.m. All right, guys.